Cancer is one of the leading causes of death in the Western world, with 2.5% of these cases being cancer of the blood, leukemia. In this video, we'll take you through the basics of what leukemia is and how treatments of the condition have developed. To understand cancers of the blood, we first need to understand what blood actually is.
Okay, so your blood is made up of four main components. You've got your red blood cells, which carry oxygen around the blood, your platelets, which will cause the blood to clot, your white blood cells, which are involved in the immune system of the body, and they're the most important factors that we need to look at when we're looking at leukemia. And then you've also got your plasma, which is the liquid part of the blood, makes up 55% or so. All the types of blood cell are formed in bone marrow, which we'll go on to look at a bit later. Leukemia comes from the Greek word for white blood, Leukos and Heima. White blood cells are formed in bone marrow from stem cells. These are cells which are pluripotent, so can differentiate into many different cell types. All the different types of blood cell originate as stem cells in the bone marrow. So they're either going to start as myeloid stem cells or lymphoid stem cells. Myeloid stem cells will differentiate into red blood cells, platelets, and the majority of white blood cells. Lymphoid stem cells will differentiate only into lymphocytes. This is a form of white blood cell. Leukemia occurs when the DNA of these stem cells becomes damaged in some way. This leads to cellular overproduction, and the cells that are produced are totally useless. The tumours are considered cancerous or malignant when they can spread. This process is known as metastasis. So leukemia can either be considered acute or chronic. The acute form is a fast progressing disease that will affect the immature cells that form the blood, and chronic leukemia sort of sets in more slowly and will affect cells in later stages of development. So we can summarise that there are four main types of leukemia. You're going to have acute myeloid, acute lymphoid, chronic myeloid and chronic lymphoid. Up until the early 20th century, leukemia was considered to be incurable. Then, in 1897, radiotherapy was developed for the first time and was found to reduce the size of tumours. However, the process is far from risk-free, and before the risks of radiology were properly understood, many of the radiologists would test the dose of radiotherapy on their own skin. Unfortunately, many of the early radiologists then, as a result, came down with leukemia themselves. Chemotherapy really revolutionised the way in which leukemia was treated. First developed just after World War II, from mustard gas in fact. The soldiers who had been exposed to mustard gas during the war were found to have a reduced number of white blood cells, which then, after further experimentation, was discovered could be used as treatment for leukemia. As time went on, you had scientists like Sidney Farber doing experiments, developing drugs like aminopterin, which would completely disrupt the DNA of the cancer cells and stop them replicating, reproducing and spreading, which was absolutely fantastic. But perhaps the most significant development in the treatment of leukemia to this day is related to the work done by the charity Anthony Nolan. All of the blood-forming stem cells come from bone marrow. Scientists of the charity discovered that by transplanting bone marrow from healthy donors into leukemia patients, the cancer could be effectively eradicated. Over the last 20 years, the donor register has increased dramatically as techniques of extraction and testing have improved. This means more and more sufferers can be treated, their lives being saved. Treatments of leukemia continue to develop, with clinical trials occurring all around the world. Here is an example of a case where these trials really paid off, looking at the drug axitinib.
2 years ago, Ian Smith could barely walk, let alone do the gardening. He was diagnosed with leukemia and given just weeks to live. Then he persuaded doctors to let him try an experimental drug, and now there's no trace of the blood cancer. A new network of clinical trial centres will give other patients the chance to try treatments that have shown promise in laboratory tests.
This is the thing that you really want in this game. You want hope, right? right to the end. Without going on this clinical trial, I would have been a goner. You know, we wouldn't have been sitting here having this conversation.
According to the charity Leukemia and Lymphoma Research, more than 12,000 people a year die from blood cancer. But there are so many types of the disease, each needing different drugs, that clinical trials have been seen as too expensive and too difficult. The new network of 13 hospitals should make testing of new treatments far easier.
Although a significant number of people are cured with drugs or transplants, many patients are destined to die of resistant or relapsed disease. So there is an urgent need to develop new drug and transplant therapies. And the UK, as I say, already has a whole network of experts. And this is trying to provide extra resource for our world-class clinicians to deliver on these vital questions.
So to conclude, we've looked at what leukemia is, what some of the treatments are, and how these treatments continue to develop. We've also looked at the case of Ian Smith, showing that clinical trials continue to progress and help save the lives of those patients suffering from leukemia. We'd also like to thank the charity Anthony Nolan for all the hard work they've put in over the last 20 years and hope that this good work can continue into the future.